Hey guys, long time no see. So today I'm going to answer a couple of your questions. I'm first going to start with the ones that were submitted last week, try to get through as many of those, and then I'll try to answer as many as I can as well from the question box that I put up last night. And just a reminder, this is a disclaimer, this is not medical advice, so please consult your doctor, physician, healthcare professional before starting or stopping anything in your healthcare routine. So just a reminder, and yeah, let's get started. First question is morning sickness normal or is it a sign of something else? So I would say it's common, but not totally normal. It doesn't necessarily implicate the health of your child, but there are a few theories on what causes it and potential causes of it. So first one is it protects the fetus from toxins ingested by the mother, so like maybe too many phytotoxins, so too many plants, nuts, and seeds that have these phytotoxins in them. It's potentially the body trying to get rid of it to protect baby, because the baby can be very sensitive to these things. It can also be caused by potentially super accelerated estrogen levels. So your estrogen levels are rising at a very, very rapid rate when you're pregnant, especially in the beginning. And this can create nausea, especially because high estrogen can affect the way that we digest food. And another potential cause of this is also adequate bile. So lack of adequate bile, which I think, the estrogen piece and the bile piece are very related. Estrogen can slow down production of bile and digestion in general, so that's also a possibility. It's also B vitamin deficiencies, so this can also affect digestion in general too, and create nausea. We need B vitamins to create stomach acid. This is why it's so important to get animal foods when you are pregnant as well. And then if it sustains for too long, this could be pyroluria. So I would definitely get checked out if it's been going on for a long time. And ways that you can remedy it. So number one, the easiest way is going to be balancing your blood sugar, eating a protein and carb together always, eating frequently. And yeah, as far as digestion, you can try having lemon water. Milk is a great source of B vitamins and protein and carbs together too, so that can help, kind of hit a lot of those things that I mentioned that could be causes. So those are just some suggestions, but number one is to balance blood sugar. That's what I would go for first. Next question is, what do you think about taking vitamin E topically? I think the person that asked me this said that their husband was having trouble digesting it or it made him not feel so good. So yeah, this is a great way to try it out. I actually recommend, for any kind of like topical things or even like mineral drops, trying to do it topically first before trying it internally to see if there's any kind of reaction, because you want to avoid that. But yeah, we absorb 60% of what we put on our body. So if your husband has trouble digesting the vitamin E supplement, this is a great way to get it in. Third question is, when estrogens and PUFAs are mobilized in the body, what does that process look like? Is it excreted somehow? So yeah, estrogen should be excreted. If not, it can recirculate, and it's usually excreted in our feces. So this is why pooping is so important, just FYI. We should be pooping at least once a day, and that's the main way that we excrete excess estrogen. So if you're not pooping at least once a day, if not twice or 3 times, there could be a problem. And then as far as PUFAs being mobilized in our body, this happens when we are under stress. And so our fat cells, our fat tissues, adipose tissues, is most likely to store PUFAs. And so when we are stressed, the body mobilizes it to create blood sugar, glucose from the fats, which is a very stressful and inefficient process. It should not be the way that we create glucose, and so it's a backup mechanism. And these free fatty acids can also create insulin resistance and things like that. So mobilizing PUFAs is not necessarily a great thing. It's mobilizing them at rest to get rid of them, but not actively mobilizing them too much because it creates a lot of stress on the system. So I don't know if that's the answer you were looking for, but if you want to ask the question in a different way, feel free to DM me. Another question is, why do so many breastfed babies struggle when moms have dairy in the diet? My baby is fussier when I have dairy. So I actually made a post kind of related to this topic, the environment that we provide when. Another question is, why do so many breastfed babies struggle when moms have dairy in the diet? My baby is fussier when I have dairy. So I actually made a post kind of related to this topic, the environment that we provide when we are pregnant kind of breeds the health of the baby once they're born and in the future. So, you know, I don't know the exact answer, but thyroid hormone, progesterone, and good small intestinal function are required to create lactase, which digests lactose, which is in the dairy. So, you know, that could be involved, whether it's the mother not having enough of these hormones and good digestive function to support the correct breakdown of lactose so that the baby can get it. That's kind of my theory, because the baby's immune system, the baby's digestive system is still developing. While it's developing at a very high rate, it might not be there quite yet to take on, you know, the additional breakdown of food like that, because mother's milk is supposed to be the perfect food. So my guess is that it starts with the mother, but, you know, I would also look at other factors, like, do different kinds of milk make a difference? So goat milk, cow milk, is it pasteurized versus raw? Is it fortified versus non-fortified? So I'd be looking at all of my options to see, you know, what could potentially be another driver of this fussiness, because dairy is a really, really great, especially milk, is really great. It's a really great source of nutrients that you need to sustain the breastfeeding. So some tips there, but yeah, don't worry too much. There are other ways to get minerals in dairy while they're not super ideal, like pearl powder. Like pearl powder can be a great source of calcium. Bone broth can be a great source of calcium. Anything with bones, like sardines, any like fish that you can crunch on, or anchovies. So like there are other options. Dairy is like pretty much a really big superfood, but like if it's causing more stress and creating more stress on the baby and you, then you have to weigh other options, and these are other pretty decent options. So don't stress or fret too much. Question is, what are your thoughts on whole fruit prenatals, specifically Nova Scotia prenatals? So you guys know that I'm not a huge fan of prenatals, regardless of what kind. That said, a lot of people are really attached to their prenatals for some reason. They think it's like a, you know, insurance policy. I don't think that way, but it's you know, it's the emotional attachment that's really hard to get over. So that said, whole food prenatals are okay. Nova Scotia, I don't know too much about it. I would just make sure it doesn't have iron in it, because that's not something you need more of or want to get more of, especially while you're pregnant. It can lead to a lot of issues. But yeah, I would say, you know, the vitamin A is not going to be the same. There's whole food prenatals are usually going to be plant-based, and the issue is here is plants are not as essential for pregnancy or just general human health as animal foods are, and so you're not getting animal foods. I highly doubt that any of these whole food prenatals are made with animal foods. They're usually plant-based. So this is where I don't agree with the whole food prenatal aspect, is because there's just so many nutrients that you're missing out on anyway, and like you're basically taking high doses of these phyto versions, plant-based versions of minerals, which are usually not ideal, not the right form, and they can take a toll on the thyroid and metabolism. So those are just my thoughts, but again, if you're really, really attached to it, you just look for one without iron, and whole food's not a terrible way to go. Can you give advice on what to do about estrogen dominance in females besides diet or DIM? So I did a post on this last week. It's called Estrogen Dominance, so go check it out. De-stressing is a really big factor, limiting your xenoestrogen exposure, chemicals in your water, cookware, makeup, personal care products. That's a really big factor that most people kind of don't realize is causing issues. If you're looking for things outside of diet or gym, like stress reduction strategies, and then removing those harmful xenoestrogen sources. So check that post out. I bet it'll be helpful. Thoughts on Botox? So this is a good question. I know a lot of people that have gotten Botox. Luckily, they're still alive. But Botox, it comes from botulinum toxin, which is one of the most poisonous biological substances known to man. It's a neurotoxin, so basically the way it works is it kills your nerves, and that's why people that get Botox, they can't smile or make facial expressions. Their forehead is just like no eyebrow movement whatsoever. Their nerves are dead in their forehead. So I know that, it's very touchy because I'm all about definitely self-care, self-improvement. Like if something makes you feel good, especially if it has to do with your appearance, go for it. But for things that come with a super high price tag for health, I'm not about it. The bacteria that it comes from, so it's called Clostridium botulinum, it blocks the release of a neurotransmitter called acetylcholine, and that's so important for so many things. I cannot tell you the importance of this or emphasize enough. So what happens is a lot of people that get Botox get headaches, they get heart palpitations, migraines, anxiety attacks, fever and chills, brain fog. They can even get blurry vision. I honestly don't, it's a big no for me, but there are some therapeutic uses, quote unquote, like my dentist, actually, I have TMJ from getting braces when I was younger, and that's one of the things he tried to do for me, but I opted for a mouth guard instead. There are therapeutic uses for it, and at some point maybe it's warranted, but it's a big no for me for most things. Hey guys, so took a little break to finish up some appointments, but getting back to the questions. So this one is, why don't you suggest zeolite? What is an alternative for heavy metal detoxing? So plain and simple, zeolite wipes out copper completely, and it's really hard to recover from this. It's kind of like mold almost, the reaction that someone can have. It can take them from being super healthy one day and really not okay to the next day. So an alternative to heavy metal detoxing, honestly, is quite a lot more simple than most people make it out to be. There's quite an industry around heavy metal detoxing, but the easiest and most simple way to detoxify heavy metals is to balance your minerals. So this is something that I work with naturally work with on people because I am an HMA practitioner, a hydration mineral analysis practitioner, and so that said, it really depends on the person and how they interpret the test. You can't just interpret it as is. So understanding minerals, knowing how to rebalance them, is the easiest way to rebalance and detox heavy metals. That's where I would honestly start, and then if there are protocols needed, then we would pursue that, but it's the most gentle and safe way, in my opinion. Do you have any recommendations for why melasma would be showing? Is there a mineral or a vitamin deficiency or stress? That's a good question. I did a post on this very recently. It honestly can be a mixture of things. Stress can release polyunsaturated fatty acids into our bloodstream. Stress also causes estrogen accumulation. Stress also causes iron overload. So it's kind of multifaceted and very dynamic, the relationship that all of these have with melasma. So it's not just one thing. You have to take a look at your whole lifestyle and nutrition to really get a sense of what's triggering these things. Maybe make a log and see when these flare-ups happen and try to track them to your cycle or something like that. That's what I would suggest, but it's not quite as easy as just like one simple thing, unfortunately. Can you address cholesterol and AGEs? So yeah, there was a post that someone had a question about recently. It's multifaceted. Stress can cause free fatty acids to release into the bloodstream. These fatty acids are usually polyunsaturated fats because they're the ones that get stored, most likely stored in the body. And if you're consuming a lot, that's also going to be a problem. So these actually cause insulin resistance as well. They don't allow insulin to get into the cell, to bring sugar into the cell. So what can happen as well is it's kind of like AGEs are basically glycated molecules of polyunsaturated fatty acids, because when polyunsaturated fatty acids rancidify, they turn into like this lacquer. You can look it up. Just apply some heat to polyunsaturated fatty acids and it's real hard to get off anything. That's happening. So then we have blood sugar that's circulating in the bloodstream that can't get into the cell. And the way that the body deals, they can cause damage. They stick to the cell wall. They can cause inflammation, and they kind of mix with iron as well. So cholesterol is an antioxidant, and it comes to the rescue to assist the body to stop the inflammation, maybe repair any walls that need repairing from the damage that the AGEs might have caused. And when you dissect this kind of like plaque, quote unquote, it ends up being oxidized cholesterol from a mixture of polyunsaturated fatty acids, which usually are at the center, with iron. It's rarely the sugar's fault. It's usually a mixture of very rancid oils and iron, excess iron, that turns out to cause, these plaques that people are blaming sugar for. So it's not sugar's fault. It can be quite more complicated than that. I've just provided a very simple example, but hopefully that helps clear it up a little bit. Thoughts on placenta encapsulation. I think this is excellent, especially for kind of regulating hormones as you post-birth and, potentially as you start to breastfeed. It can just kind of help keep things smooth, if I should say, hormonally and mood-wise. That's something you have to consider, because you can also do lotus birth. So placenta encapsulation is kind of like, giving you the goodness of your placenta, but then the lotus birth is giving your baby the goodness of the placenta. So it's something you want to consider and weigh the pros and cons of, but it's really up to you. I think it's excellent. What would cause a Charlie horse leg cramps in calves at night during pregnancy? This is most definitely a magnesium deficiency, but you don't want to go and just supplement magnesium willy-nilly. You need to make sure your other minerals are also boosted. This is something that you'd have to work on with a practitioner. So you could try magnesium, maybe try magnesium oil, but I wouldn't go taking huge doses of magnesium before checking your other minerals. So that's that. And for a long time, but just started eating animal foods because I want to try to conceive. How long to replenish? So this is probably not going to be the answer you want to hear, but it's going to take at least 2 to 3 years for you to actually replenish properly. And I'm very serious about that. So, have some patience, maybe adjust your timeline, but it's very important to do that for the sake of your health and your baby's health. Veganism and vegetarianism do not provide adequate nutrition for growing a baby. So good luck. I highly suggest incorporating animal foods, slowly, but, definitely focusing on them and really getting a lot of them over the next few years. Currently breastfeeding, pediatrician is adamant about vitamin D supplements, thinking about taking vitamin D drops as an alternative. Thoughts? So you guys know how I feel about vitamin D. I think it's, pretty close to poison. Pediatricians don't quite understand, and doctors in general, just keep in mind, this is actually a really good reminder that most medical doctors do not have more than 25 minutes to 4 hours of nutrition training. They are pretty, unless they've done other, research outside of their education, this is not something that is emphasized at all in their curriculum. So that's something to really, So it's really unlikely that they're going to understand the dynamics between vitamin D, vitamin A, calcium. I mean, maybe they understand a little bit about calcium, but it's a lot of it is lost on them, the intricacies, and these are very intricate things, and you have to continuously research them to quite understand and keep up. That's why prenatals are recommended so willy-nilly. That's why, in general, medications are. They follow the Merck manual. That's their thing. So, that's my dog playing. When your doctor is telling you to supplement vitamin D, they probably don't fully realize that by nature's design, there is no vitamin D in breast milk, because nature knows that it is dangerous to provide a baby whose immune system is still growing, whose bones are still forming, vitamin D. It's going to calcify them. Vitamin A is so important for a baby's health, especially as they're growing. That is the true MVP. It helps with differentiation. It's way more important to bone health than most people realize, way more important to immune health than most people realize. And so when you take vitamin D supplements, it's going to suppress vitamin A. It's going to stop it from being able to work. It's going to deplete magnesium. It's going to deplete potassium. It's going to deplete copper, which the baby needs as well. So I really don't think it's a good idea. I personally wouldn't do it if it were my doctor, but again, you have to make the right decision on what feels right for you. I can't tell you what to do. You should do your own research, because, I'm somebody on the internet technically. But also, you don't have to feel, if your doctor's pushing you into a corner and it feels strange, definitely take that as a sign, because you don't have to do what they say either. So, I would say do your research, do what feels. Just remember there are other options like sunlight, which you and your baby can get. So do your research, follow your intuition, and that'll be the best decision that you make for you and your baby. So do what feels right for you. What if I'm turning orange from carotenemia after consuming carrots, sweet potatoes, etc.? So this is a sign that your body's not able to convert the beta carotene that you're consuming in probably high amounts to vitamin A. Just remember that it takes 12 units of beta carotene to convert to vitamin A. And what else? High amounts of beta carotene is actually pretty damaging. So it's really suppressive to the metabolism. It could feed bad bacteria. So if you're consuming them and pounding them, just remember that it's probably not a good idea. If you're still getting this when you've cut it down to maybe just a carrot or two a day, then this is still a sign that your body's under quite a bit of stress. So I would probably switch to other foods, other vegetables that don't cause this reaction for you. My 17-year-old son gets very red and shaky hands. I have RA. He takes liver tabs, D3, calcium, and K2 every day and eats well. So it's really hard for me to say what could be causing his red and shaky hands. This could be, a food allergy. This could be a blood pressure thing. This could be a thyroid thing. So unless, I know more details about him and his lifestyle, I probably won't be able to answer fully. But I will say that liver is great, but D3, like I just mentioned earlier in this video, I'm not a fan of, as well as calcium. Taking calcium is going to calcify your body. And if this is related to thyroid or blood pressure, that'll definitely play a role, as well as vitamin D in that. So, probably something to consider, but I need to know more information. What would you recommend to take post-menopause to help with eye dryness and articulations? I would probably take something like vitamin E. Mitolife has a great product, and I would make sure I'm getting enough fat-soluble vitamins as well as electrolytes and copper, because those could have plenty to do with hydration and moisture in your eyes. So that's probably where I would start. Do you have any tips for blood pressure and heart health? So blood pressure issues usually have to do with mineral imbalances and can also have to do with stress and thyroid levels. So probably getting these all checked out. Taking your your temperature and pulse is also a great way to see kind of what's happening as well. I have a free guide in the link in my bio that will kind of tell you the ranges that they should be in, but to get a really deeper look, You probably want to run a hair tissue mineral analysis to see what's going on with the electrolytes, because they act as spark plugs in the body. So usually if there's a heart issue, there's an electrical imbalance, and that points to electrolytes and minerals. Can I donate blood if I'm underweight? Probably not, but you can always schedule a session with a lobotomist in your area. Is there a detox that can occur when changing eating habits? I have been experiencing a lot of feelings of anger, eating cleaner, more frequently, high quality and quantity than ever before. Yeah, this can definitely happen. What you eat provides the food for the bacteria in your gut, so it's prebiotics. It's feeding different bacteria probably than it's been what you were eating before was feeding. So definitely that change can happen. Your breath can smell different, your armpits can smell different, so your body odor. But yeah, feelings can change too. We often go through life very numb because we're under this very, very we're in the stress state, and stress hormones numb us by design. So when we start to come out of this stress state, sometimes we feel worse, and we can actually see what's happening inside the body, what the mood is, how the function is, etc. And once you start moving things too, like calcium and copper, when you start to move calcium, a lot of people have calcium shells, which numbs them as well. You can actually start to feel different emotions. And if you start to move heavy metals as well, because your metabolism is increasing, this can also trigger lots of emotions. It really depends how extreme these emotions are. I would really try to balance your blood sugar, because this can usually lead to anxiety that most people don't realize. But if the emotions are very high, maybe talk to your doctor or seek some therapy if it's something that you feel like you need to talk to somebody about. Keep in mind, we are also in the middle of a pandemic, a never-ending pandemic, and that's creating a lot of stress for people as well. So there could be some other factors that maybe you're not thinking of potentially. I'm not sure. I don't want to speak for you, but maybe there's something else in your life that may be creating this feelings as well. So good luck. Thoughts on zinc supplements for polyuria? So you guys know that I don't like zinc either. I have a post on this, but I'm going to make a more clear one very soon. Zinc can basically deplete copper. It shares receptors with copper, and so if you're taking zinc supplements, it's going to, there's a fruit fly in here. If you take zinc supplements, you're kind of depleting your copper as well, because it also triggers the synthesis of a protein that depletes copper. It's not just like pushing it out, it's depleting it. So polyuria is also a hallmark of copper dysregulation. So you're probably extremely copper deficient, and you probably have iron overload. So these are things you might want to pursue. I would probably start by looking at the root cause protocol for the basics, and then you can work with a consultant like myself that can help you work through the ins and outs. My cholesterol is borderline high at my last blood test, has never happened. Thoughts? This person also talked about how they're eating pro-metabolic. My question for you would be, how long have you been eating pro-metabolic? What was your diet and lifestyle like before? Because sometimes things get worse before they get better. You can't just jump into a new lifestyle and way of living and eating and expect things to kind of smooth out, especially if it's for the long term. A lot of the time, the long-term benefits and the long game, if you play the long game, you might see a little bit of reversal first before things get better. So things need to kind of work themselves out, and it often looks like symptoms are getting worse, but it's just a little bit of time that needs to pass. So my question for you would be, maybe 6 months from now, see how it goes and see where it is, but I wouldn't worry about it too much. What is your first choice for vitamin D production, lights or lamps? Spur tea. Any tips on increasing cholesterol? So I would probably look at all the stressors and factors in my life, as well as my diet, because maybe I've been running on empty for quite a while. Low cholesterol can also be caused by stress and hyperactivity of the metabolism. So I would look at all that and see where can I slow down and really say no to things so that I can start to heal, as well as consume cholesterol-rich foods. So things like high quality dairy, high quality grass-fed meats, eggs. Those are going to be amazing. Visible veins in legs. I'm 20, fairly active, recovering vegan for 2 years. I would check out my post on varicose veins. This is very similar. Any kind of breakage of the structure of the veins has to do with copper deficiency. So you're probably deficient in other activators and minerals that you need to get in your diet still. If you've been vegan for a long time, it's going to take longer. So 2 years, if you've been vegan for 10 years, 2 years is probably going to take you a couple more years to really truly recover. So keep on keeping on, check out that post, and good luck. Sourdough need to be organic to be considered healthy. Not necessarily, but just remember that conventionally grown grains usually have a crap ton of pesticides on them, including things like glyphosate, which can really irritate our guts, lead to hormonal imbalances, mineral deficiencies, etc. So it's not that it's necessarily quote unquote healthier, but you're getting all this extra stuff usually with non-organic sourdough. So a few things to consider, but at the end of the day, you have to do what's right for your budget and what you want to prioritize in terms of like budget and energy. What's the average calorie count for females? I struggle to get 1,300. So this is going to be very, very bio-individual for everybody. So I can't provide an average because yours is going to look different than the next person's. It's going to look different than the next person's. I would say 1,300 is pretty low in my opinion, just having worked with a lot of women and seeing where their metabolism is. If you're a grown woman, I would say that's a little low in my opinion. But I have people that eat 1,900. I have clients that eat 2,300. I have some that eat 3,000. So it really depends on you as a person, what your body needs as support. And this also changes throughout your, phases of seasons and cycles and phases of life. So it's hard to say. It's probably not the answer you want to hear, but the perfect way to try is to test and measure. Thoughts on keratosis polaris. So this is, in my opinion, this is a vitamin A deficiency, but it can also be triggered by other things like digestive issues, stress. So I might start by making a log to see when this appears. So, if it's around a certain time of cycle or a certain time of stress or a certain time of food, see where it's really coming from so that you can get down to and associate when it happens and what the triggers are so that you can, from there, like what's causing it. Okay, then you can figure out, how do I tackle it? Is it my stress? Is it my hormones? Is it actually a mineral or a vitamin deficiency? And go from there. Thoughts on the safest kind of grill, charcoal or propane? So they both have their downsides. It's really whatever's available to you. I would prefer charcoal personally, but charcoal does have iron in it, so it's like then you're getting propane, and the propane gas is probably seeping into your food anyway. So it's a pro and con that you have to weigh for yourself. Is it a pain to do charcoal? Are you grilling really frequently? Like, these are all considerations to make, as well as budget too. So like, I wouldn't really stress that much about it, especially if you're not using it that frequently. Best kind of pots, steel. So I did a post on cast iron recently. All kind of cookware has downsides. You just have to make the right decision for you and your budget and your family and kind of like your health situation. I personally use ceramic, but I'm doing research on this because someone said recently that there was an independent study conducted on ceramic and they actually had heavy metals in it. So I'm going to do some more research, but right now I'm eyeing the Vision glassware. That's what I'm kind of looking at. Otherwise, I would use stainless steel when I don't use ceramic, and cast iron once in a while to make steak. So those are the kind of three that I use, but Vision glassware may become my main squeeze. UTIs, want to avoid antibiotics, breastfeeding, been using D-mannose, cranberry concentrate, silver. I would honestly go see a pelvic floor specialist because UTIs can be caused by a structural imbalance in the pelvic floor. It's often overlooked. Go check out my friend, the preconception PT. She's a pelvic floor specialist. And as far as silver, that's not something I would be taking. That thing that mineral builds up in the body. It's really difficult. There's pretty much no way for the body to get rid of it. So I would probably not do that. But again, it's up to you. You advise against retinol face products, especially for preparing body for preconception. So it depends how many hairs you want to split, but synthetic retinol will feed bad bacteria. So if you have any kind of issues going on already, whether it's internally or externally on the face, it could cause problems. I'm not a fan of synthetic vitamin A, and you know, that's not the only thing you should be thinking about, but I personally would avoid it. But yeah, that's my answer. Thoughts on progesterone only birth control, any better on the body than the regular pill? So I think some of them may allow ovulation once in a while, which is kind of okay, but I think some of them also they have higher risks for heart issues. I can't quite remember exactly, but they have a higher risk than the estrogen and progesterone pills for some, illnesses or diseases. So there's honestly a lot of cons with every contraceptive. Even the copper IUD has cons, but if you're thinking about conceiving soon, you're going to need to replenish for about 1.5 years, just FYI, when you get off the pill. But you want to also make sure that you prepare your body for getting off the pill. Talk to your doctor, start replenishing now to make it easier, the transition easier, because depending on how long you've been on the pill, your body is probably going to experience quite a bit of shock. And there's a lot of synthetic hormones that you're going to need to detoxify, and your body's probably very, very depleted in all of the nutrients that you need to make a healthy baby and be fertile. So there's going to be a lot of repairing that needs to happen. So start preparing now, talk to your doctor, and there are other ways. So like FAM, for example, you can use FAM, track your cycle. We're only really fertile for 5 to 7 days out of the month. And in my opinion, it's kind of ridiculous to take a hormonal birth control pill that can increase our risks for so many things 100% of the time. So that's just my opinion. But you have to do what's right for you and your partner and your family. So let me know if you want to chat more about this. I will be posting more about this too very soon. That's all I got time for tonight, but stay tuned for next week.